I have never given much thought as to why we call the health center in the city of Montego Bay Type 5 until one of my recent videos about the rehabilitation of the Cordell Regional Hospital. While researching that video, I learned that it's a Type A hospital, and that just got me thinking, what's all this Type 5, Type A categorization all about? And actually, now that I think about it, I remember wondering about the Type 5 health center a few years ago, but I didn't do any research at that time. But I did some research for you and me, of course. Welcome back to RC Island Girl Jamaican Vlogs. This is another addition to my Learn With Me series. If you enjoy learning about Jamaica through walking, driving, historical, and informational videos, then hit the like button, subscribe, and join the tribe. Let's get started with an overview. So in 1997, Jamaica's healthcare system went through a revamp, which included decentralizing the system and the creation of 4 regional health authorities with the responsibility of delivering healthcare to the population of Jamaica. Now, these 4 regional authorities are the Western Regional Health Authority, Southern Regional Health Authority, Northeast Regional Health Authority, and the Southeast Regional Health Authority. Each region has a number of hospitals and health centers under their management. The Western Regional Health Authority, for example, is in charge of 4 hospitals and 84 health centers. Now, as you know, health issues are varied, and the type of healthcare needed will depend on the patient and, of course, the severity of the illness. It is therefore important to know the 3 different levels of the healthcare sector in Jamaica so that you know which level provides the services you need. Jamaica's healthcare system is made up of primary, secondary, and tertiary healthcare services. Primary healthcare focuses on prevention, while secondary and tertiary healthcare focuses on curing or managing diseases. Primary healthcare is the first point of contact to address your medical concerns. This is usually done by community healthcare centers in the public sector or your general practitioner in the private sector. The main focus of primary healthcare is prevention. They are responsible for coordinating your care and, if needed, referring you to the next level of the healthcare system. In general, complex procedures, surgeries, and treatments are referred to hospitals. Examples of primary healthcare professionals include doctors, nurses, and physician's assistants. Secondary healthcare is basically where specialized care takes place. Therefore, if a doctor or another healthcare professional does not have the required expertise to treat a specific illness, they will refer you to a specialist in that area. Examples of specialists include gynecologists, psychiatrists, or pediatrician. Now, you'll be referred to the tertiary level of healthcare services if you're in need of a level of specialized care that the secondary level of healthcare is not able to provide. There are, however, some small hospitals that may not be able to provide you with the advanced care required, and in that case, you may be referred to a type of hospital that is able to provide highly specialized services. Now, this leads me to the classification of hospitals in Jamaica. In Jamaica's healthcare system, hospitals are classified as either Type A, Type B, or Type C. Type A hospitals provide highly specialized and full-scale secondary and tertiary healthcare services. Hospitals in both the private and public sectors may refer cases to Type A hospitals. Cordell Regional Hospital is currently the only Type A hospital in Western Jamaica. Type B hospitals provide primary and secondary health care and restricted specialist services. If more advanced care is needed, they will refer their patients to a Type A hospital. An example of a Type B hospital in Western Jamaica is, I want you guys to guess, Savannah Lamar Public General Hospital. Type C hospitals mainly offer primary healthcare services and some basic secondary healthcare services. An example of a Type C hospital in Western Jamaica is, can you put that in the comments? Falmouth Public General Hospital. Now on to health centers. Health centers provide easy access to primary health care without substantial cost. They prevent certain cases from flooding the hospital's emergency departments, thereby reducing the waiting time at hospitals. There are 5 types of health centers in Jamaica's healthcare system. These classifications are related to the services provided and the population that they serve. Type 5 health centers are full-scale health centers that are only found in urban areas. For example, the Type 5 Health Center in Montego Bay, which is located on Payne Street, and that is Payne Street, not Pain. Type 4 health centers conduct the parish's health program. This is also where the parish and medical officer of health is located. There is a Type 4 health center in Lucy, Hanover, and another in Falmouth, Trelawney. A health center classified as Type 3 houses the head office for the health district. The population they serve may be about 20,000 people, and this is usually done through a number of Type 1 and Type 2 health centers. Type 3 health centers in Western Jamaica are located in Catherine Hall, Cambridge, Darlington, and Albert Town. If you've learned something new from this video so far, or you are enjoying the content, hit the like button and share with a friend. Moving on. Type 2 health centers have a resident nurse who is able to provide basic treatment for common illnesses. Type 2 health centers are able to provide more expertise than the Type 1 center. Type 1 health centers are closely linked to the community and are the smallest of the 5 types of health centers. They have a midwife and a community health aide, both of whom are in charge of offering immunization services, family planning, and monitoring the nutrition and health of the mother and child.